Craig is 40 years old and he's developed an 8 out of 10 headache over the last hour and a half. Craig has a history of headaches, but they normally come on over 2 to 3 hours and are preceded by an aura. However, today is slightly different. He has no nausea or vomiting, the pain is unilateral and constant, and he has photosensitivity, and these are normal for him. He's got no neck stiffness, altered level of consciousness, no preceding trauma or triggering events, and he denies any recent surgery or head trauma. Craig states that recent extensive exposure to computer screens due to stressful workload may have instigated the headache. Sample, Craig's got no allergies, he's got no other medical history and takes paracetamol, ibuprofen and amitriptyline when he has headaches. Craig, have you taken your meds today?
Yes.
Okay. He doesn't take any anticoagulants. His food and fluid intake is normal, as is his bladder and bowel function. He's got no personal or family history of intracranial hemorrhage, and a full set of vitals done by my colleague are all in normal range. He is systemically well. The patient is fast negative and he has consented to me assessing him. Okay, Craig, have you had any recent illnesses, coughs, colds or sinus? No. Okay, so I just need to palpate the face gently now. Just tell me if you have any discomfort. Anything through here?
No.
What about through here?
No.
Down in here?
No.
Okay. What about through the jaw area?
No.
How about these glands? Do they feel okay?
Yep.
There's certainly no swelling there. Do you have any discomfort in your neck?
No.
Okay. Can you just drop your ear to your shoulder? Okay. Other side. Down to your chest. And how was that? Did it bring on any pain?
No.
Okay, Craig, I just want you to follow, just use your eyes. Follow my finger. Great. Okay, now what I'd like you to do is touch your nose with your finger and then touch my finger. Again. And again. Again. Keep going, keep going. Excellent. Okay. I know that the light hurts your eyes because you've got quite a nasty headache, but I just need to quickly check your pupils. Okay. Have you had any visual disturbances in the last hour or so?
No.
Okay. Can you blink for me? Okay. Can you raise your eyebrows? Okay. No discomfort? Okay. Can you open your mouth for me? Great. Poke up your tongue. Good. Big smile. Okay. Can you feel me doing this?
Yep.
Okay. What about on the other side?
Yes.
Here?
Yes.
Okay. Craig, there doesn't appear to be anything sinister going on. The assessment certainly is normal. But we just go through the checklist, which I've got in my pocket, to make sure that we haven't overlooked anything more sinister. So, your headache didn't follow manipulation. You've got no neck pain or stiff neckness. It wasn't a sudden onset. You don't have a temperature greater than 37.5 degrees. You've got no severe vomiting or neurological deficit. No altered level of consciousness. The headache hasn't gotten worse after trauma, and you've had no trauma. You're not taking anticoagulant. No signs of temporal arteritis. You've got no previous history of intracranial bleeding or no family history of cerebral vascular abnormalities. I didn't ask you, did this come on during sexual activity? Okay. So the symptoms aren't associated with sinusitis. However, your symptoms are slightly different from normal, so I'm not happy leaving you at home. However, I don't think you need to be taken into ED. How would you feel about me giving your GP a ring and seeing if we can get you an appointment? And if so, I could pop you down there.
That'd be fine.
Okay, Craig, great. Your GP can see you. Now, as you've taken all your pain meds, I can't offer you any more paracetamol or ibuprofen. I could consider tramadol. How do you feel about that? Would you like some or not?
No.
Okay. Opiates are discouraged for headaches, however, they're not discouraged if the pain is severe. Okay, that's great, Craig. We'll get you ready for transport. I will now just step aside with my colleague and go through the non-transport pause just to ensure it's safe to leave livestock. You can stop. I'll cut that out. We're taking him somewhere anyway.
Hopefully that's stopped, is it?
That's right, I can cut it.
How do I push? How do I get it to stop? I think you did.
You already have, haven't you?
I don't know, it's still going.